Welcome back, our dear viewers, to the next segment of medical news, which will be about Stroke Awareness Day 2016 in King Fahd Medical City, Wednesday, October 26, 2016. A stroke, sometimes called a brain attack, occurs when a blockage stops the flow of blood to the brain. We call it ischemic stroke. Any complications ranging from death to paralysis or weakness of the one side of the body or the face, in addition to problems.
1 week of physical therapy sessions. Some patients need a month, some need more than that. So it depends on the patient.
For the Stroke Awareness Day, we're going to talk about the role of a speech-language pathologist in terms of swallowing and speech. When a patient gets a stroke, the location of the stroke and the age of the patient and a lot of things affect the severity of the stroke. From speech-language pathology, patients will sometimes show signs of aphasia, what we call aphasia. It could be Broca's or Wernicke's aphasia, which means the language could be affected receptively or expressively. They could also have problems with memory, problems with cognition, behavioral issues. So these are basically the language disorders you can see in stroke patients. Also for swallowing, patients could show difficulty swallowing. That could be in the oral phase or in the pharyngeal phase, showing signs of aspiration, coughing, gurgly vocal quality. The role of a speech-language pathologist is basically to therapy techniques. We have alternation techniques, inconsistencies, and so on.